Hello and welcome. Today we're diving into a rare but serious heart condition called anomalous left coronary artery from the pulmonary artery, or ALCAPA, what it is, why it happens, and how it's managed. Let's get started. ALCAPA is a congenital heart defect, meaning it's present at birth. Instead of originating from the aorta, which is the main artery carrying oxygen, rich blood from the heart to the body, the left coronary artery originates from the pulmonary artery, the artery carrying oxygen, poor blood from the heart to the lungs. The exact cause of this abnormal connection is unknown. It's thought to result from errors during the very early stages of fetal heart development, specifically during the formation of the coronary arteries. Let's understand the underlying mechanism. The pulmonary artery carries deoxygenated blood. When the left coronary artery originates from it, the heart muscle, specifically the area supplied by the left coronary artery, receives blood that is low in oxygen. Initially, while pulmonary artery pressure is high in newborns, some blood flow can reach the heart muscle. However, as pulmonary artery pressure decreases during infancy, blood flow to the left coronary artery may reverse. Blood that has already supplied the heart muscle may then flow backwards into the pulmonary artery. This phenomenon is known as coronary steal. This results in myocardial ischemia, or a lack of sufficient oxygen to the heart muscle, potentially leading to heart damage, heart failure, or even sudden cardiac death if left untreated. ALCAPA is a rare condition. Estimates suggest that it occurs in approximately 1 in every 300,000 live births. It accounts for a small percentage of all congenital heart defects. Because it's often detected in infancy, and sadly can have high mortality if left untreated, accurate prevalence numbers are challenging to obtain. The signs and symptoms of ALCAPA can vary depending on the severity of the condition and the age of the individual. In infants, common symptoms include colicky behavior, excessive crying, poor feeding, sweating profusely, especially during feeds, rapid breathing, and pale or bluish skin. These signs usually appear within the first few months of life. Older children and adults may experience symptoms such as chest pain, shortness of fatigue, dizziness, and palpitations. Some individuals with ALCAPA may be asymptomatic until later in life, when heart damage has already occurred. Diagnosing ALCAPA involves a combination of clinical evaluation and diagnostic testing. A doctor may suspect ALCAPA based on the patient's symptoms and a physical examination, including listening for a heart murmur. The primary diagnostic tool is an echocardiogram, which uses sound waves to create images of the heart. This test can often visualize the abnormal origin of the left coronary artery. Other diagnostic tests may include an electrocardiogram (ECG) to assess the heart's electrical activity, a chest X-ray to evaluate the size and shape of the heart and lungs, cardiac MRI or CT angiography to provide detailed images of the coronary arteries and heart structure, and in some cases, cardiac catheterization to directly visualize the coronary arteries and measure pressures within the heart. While ALCAPA doesn't typically have distinct types, it's important to consider the extent of collateral vessel development. Collateral vessels are small connections that develop between the right and left coronary artery systems. The presence and extent of collaterals can influence the severity of symptoms. Well-developed collaterals may allow for some blood flow to reach the left coronary artery territory, potentially delaying the onset of significant ischemia. The primary treatment for ALCAPA is surgical correction. The goal of surgery is to restore normal blood flow to the left coronary artery. Several surgical techniques can be used, including direct reimplantation of the left coronary artery from the pulmonary artery to the aorta, creating a tunnel within the pulmonary artery that connects the left coronary artery to the aorta, called the Takeuchi repair, and performing a coronary artery bypass graft using a vein or artery from another part of the body to bypass the abnormal connection. The choice of surgical technique depends on the individual patient's anatomy and the surgeon's expertise. After surgery, patients typically require ongoing monitoring and may need medications to manage heart function. Medications may include ACE inhibitors, beta blockers, and diuretics. Currently, there's no known way to prevent ALCAPA, as it's a congenital heart defect arising during fetal development. Prenatal care and a healthy pregnancy are always important, but they cannot prevent this specific defect. The prognosis for individuals with ALCAPA depends on several factors, including the age at diagnosis, the severity of the condition, and the success of surgical correction. Early diagnosis and treatment are crucial for improving outcomes. Without treatment, ALCAPA can lead to significant heart damage, heart failure, and even sudden death, particularly in infants. With successful surgical repair, most patients can live relatively normal lives. However, long-term follow-up is essential to monitor heart function and address any potential complications. Recent research focuses on refining surgical techniques to minimize long-term complications and improving diagnostic methods for earlier detection. Minimally invasive surgical approaches are also being explored to reduce recovery time. Additionally, research into the genetic basis of congenital heart defects, including ALCAPA, may lead to a better understanding of the underlying causes and potentially preventive strategies in the future.